Welcome to the Practicing Integrative and Whole Health podcast, where leaders talk about why that matters. We're tackling topics and ideas about how to make it the norm by transforming systems and the health and well-being of people and communities in America. I'm your host, John McKenzie. I'm the Executive Director of the Division of Academic Innovation for the University of North Texas Health Science Center in Fort Worth, Texas, also known as HSC. HSC is the jointly accredited provider for the inaugural Bringing Whole Health to Life conference taking place October 25th to 27th, 2024, which is led by the Academy of Integrative Health and Medicine, or AIHM. Today, we are joined by two remarkable leaders, Dr. Rachel Abrams, Chair of the Board for AIHM, and Dr. Jeff Beeson, HSC's Interim Executive Vice President of Health Systems and Vice President of Clinical Partnerships and Initiatives. Welcome, and thank you both for joining us.
Thanks for having us, John.
Absolutely.
Thanks so much.
Yeah. Right off the bat, we have a series of questions. I'm hoping for a lively conversation back and forth, and I know both of you bring that to the table. And let's start with you, Rachel. Would you start off by just sharing with our audience a little about your background? How did you get started, and what brought you to where you are today?
Oh, my goodness. Well, I born and raised in Southern Illinois, not so different from Texas, actually. And I really always wanted to be a healer, but I had the experience when I was a 15-year-old of helping my grandmother die, which sounds hard, and it was hard, but it was also really beautiful. And I felt myself pulled into the healing professions. My father is a pastor. And in fact, when I applied to college at 17, I wrote my entrance essay on mind, body, spirit, healing, and medicine. So It's been a long passion of mine, and a real bringing together of my background, my love of science, and my love of the whole human being, which is what we're talking about today, whole health. And then I did traditional medical training. I'm an MD. I trained at San Francisco. But I was mentored in my early 20s by Gladys McGarey, who is considered the mother of holistic medicine and is one of the founding members, along with Norm Shealy and a number of other people, of the American Holistic Medical Association in 1977. And I got to be really mentored by her through today. So she's 103 and a half.
Incredible.
And still my mentor and the previous president of my organization. So the AHMA became the AIHM, same thing. This is just our family history. And the AHMA then, and eventually the AIHM, became my home, my professional home, where everyone there is all about connection and about mind, body, spirit, medicine. How do we look at the whole person? How do we put the patient in the center of everything we do? And how do we really use everything at our disposal? Not just drugs, but all the things, whether it's herbs or Chinese medicine or exercise or acupuncture, chiropractic, deep delving into roots of problems with people. How do we put that all together? And there's nothing more fun that I do. I love practicing medicine. I've been in practice for over 2 decades. And it's thrilling to be the board chair of the Academy of Integrative Health and Medicine because it's felt like my home for a long time.
Thank you, Rachel. Jeff, same question. How about your background?
My background, John, is a little different. So I was born into a public safety family. My father was a police officer who was at this time running a hospital-based ambulance service in rural community in Texas. And so I kind of grew up into emergency medicine through the pre-hospital public safety world. And then all through my life, both my father being in law enforcement and then my brother being in the fire service and also EMS. So in high school, I started as an EMT and progressed on to becoming a paramedic. Went to college, got my nursing degree, became a registered nurse, and then spent about 15 years in emergency medicine, working in ambulances, got into aeromedical helicopters, and then came back to medical school later in life.
Wow.
And so through my medical training in medical school, going here to Texas College of Osteopathic Medicine, training as an osteopathic physician, much different approach to medicine. I shouldn't say much different today. It was, 20 plus years ago are more a little different, but really looking at the whole person, understanding structure and function that the human body has the ability to heal itself.
Mm-hmm.
And then when I got into my emergency medicine training and was in the emergency department and would see patients coming in with problems that weren't particularly health related, were more community and social, the other determinants of health that we all know about and talk about today. And really, someone got frustrated because there was little things that I could do. So I got into being the medical director for emergency medical services, so ambulance services, and really moved into the out-of-hospital environment early in my career, and really got into innovative delivery models, working with communities, very much public health and other things, which ultimately led me here to the Health Science Center, where I now am leading our whole health initiatives and trying to design new models of care that really deal with all of the issues our patients and clients have, other than the traditional medical or clinically related things we think of.
Wow, such a journey for both of you, and you can really hear the passion in both of your stories and how you got to where you are and what you do today. It sounds like there is a story that led you to want to work in healthcare. Is there a story or a moment that inspired or triggered you to want to work towards whole health?
I think it's just, 30 years of, as an emergency medicine physician, as a paramedic, you see the fragmented delivery system. And I realized in my time on the ambulance that I was taking sicker patients out of the back door of the hospital than I was taking in the front door of the emergency department, and thought there just has to be a better way. And so when I became a faculty member and was teaching residents, I really came to realize the lack of their knowledge of things that aren't in traditional medical education and nursing education and all of our health professions. So really got into the focus of delivery systems and trying to open their eyes to the things we don't traditionally think about. So one of my mentors, his father, said years ago, your eyes will not see what your mind does not know. And so there's a big piece of opening our future healthcare providers to the real issues. Is it's easy to write a prescription and you know how to treat their condition, but it's more of where are they going back to, and it's hard to have a patient prioritize their medication, which they know they need, but they're also struggling to pay their rent or keep the electricity on. And just a combination of those things that really frustrated me and really drove my desire to make the system better and be involved in the solution. And that's what kind of drove me to whole health. And now my various background of being the paramedic, nurse, physician, now building teams and really looking to what Rachel's passion is and the non-traditional methods of health and delivery and the things that we educate in silos. I don't really want to say that as a negative thing, but we really educate in our own professions. And then when we get out into the actual healthcare delivery world, we're supposed to play together in a sandbox, but we don't even know who the other players are. So how do we move that forward and really start preparing our providers, preparing our future healthcare providers in what's possible?
Excellent. Thank you. And Rachel, it sounds like for you, a similar kind of drive and passion and that relationship to your family, I think sounds important for you as well with this question. Was that one of those major turning point moments for you, or what was it about that experience that drove you towards whole health specifically?
Certainly, my family had a big influence on me. I grew up in a very spiritual family, but also a very scientific family, and we never considered those separate. They went together. So that has had a big influence. And patience, I have to say, like Jeff, I have had the experience of working in county hospitals, of working in big cities, of working in small towns. And if you really want to know what the root of the problem is, there's no time for that in Western medicine in the way we currently practice it. We don't have enough time to learn about the early trauma that is now causing abdominal pain, or to learn about the physical abuse that means that this person can't feel their body and keeps doing, dangerous things and having multiple fractures. And, we don't have time. And it's bad medicine. And I'm someone who really likes things to work well. And medicine, as it is currently structured and incentivized, doesn't. So one story that occurs to me about this, in addition to being a physician for decades, I have now walked 3 family members through cancer, 2 parents through dementia, 2 family members through traumatic brain injury. I've had quite a bit of contact with the healthcare system in the last 6 or 7 years. And one of those is with my brother-in-law who lives in Houston, Texas. And he was addicted to a variety of drugs, including narcotics, when he was a young man. He got clean and sober. He founded, currently still functioning in downtown Houston, the most successful recovery center that Houston has had. In fact, the mayor just named a day of the year after him to honor him. But after his recovery from drugs, as is often true for addicts, he overate. And he lives in a beautiful home. He is middle class, but that home happens to be in a more impoverished neighborhood in Houston. There is, and I've lived with them there. There is no good food near there. There are no grocery stores that stock any of the healthy food that I can get in a liberal town in California. And in their home, the pantry was a disaster. I would just go there and go, oh my God, you have diabetes. What are you doing with, Wheat Thins and Chips Ahoy? And he, as a sugar addict, already had liver damage from his addiction, and then developed very severe diabetes and really had a hard time controlling it. And the only care he got, because he might be a middle-class man who's doing amazing things in the community, but when he goes to the hospital, he's just a Black man from an impoverished neighborhood in Houston. And I reviewed his medical records because he developed kidney failure. And he had such poor quality care. And literally not one person ever visited his house. He never had a good nutritionist. He never had any alternatives or anybody talking to him about how could he exercise? What would that look like in his neighborhood? How can we help him? Nothing. Those very simple interventions early on would have changed his life. He is no longer with us. And he's no longer with us also because of how the healthcare system works with transplant medicine and bias. So these are all big problems of the healthcare system. Bias, lack of access, inequity, nobody in the home, no community healthcare workers that can actually relate to what's going on, and simple problems like eating too much sugar for this amazing man become huge problems, like I need a kidney transplant or I'm going to die. So I am passionate about this because it has touched my patients, it has touched my family, and it's touching literally every single person in the United States right now. You think you're getting quality care, you're probably missing enough counseling around how to eat well and how to do that where you live, around how to be active and when to be active, around good sleep, and the answers to these things are actually not complex. The diet wars continue, but that's mostly a media thing. The truth is we know what a healthy diet is, and it's pretty basic, but a lot of people don't, or they just need help figuring out how to do that. What do I buy at the grocery store? What should I have in my house? Simple questions that would help with complex problems. 90% of the medical issues that walk into a primary care doctor's office, I'm a family practice doc, are caused by lifestyle and environment. That means we can do something about it. So the thing I'm most excited about with whole health is it's whole. So it's not just MD-DO doctors. It includes chiropractors, acupuncturists, psychologists, social workers, people doing groups to support trauma, organ transplant people, for all diabetes, all kinds of things, so that education and real support goes hand in hand with medical care, not in a different location, in the same place. And that all those team members are working together on the same team to help people like my brother-in-law, who is no longer with us, have a full life and reach their full potential.
That's an incredible story. And thank you for sharing that with us. And I think the other thing that you did so well with what you just shared with us is such a powerful description of the problem and leading us towards some form of what that solution may look like. And whole health may be a part of that solution. For our audience today, we have that health professional audience that will be listening to our podcast today, and they are comprised of those professions that you just listed and others and beyond. Could you tell us a little about what would it mean to you, or what would it look like to make whole health a focus in healthcare for these practitioners?
Very excited about this question. So it's a couple of things. And I will say that these are values that the Academy of Integrative Health and Medicine holds dear. In fact, if you go to our website, they're exactly what our values are. The patient is the center of care. And in whole health, you actually ask the patient, what do you care most about? What are your deep values? Because we're going to actually work your care around that. There has to be a reason that you want to make changes, that you want to make difficult behavioral changes, that we work holistically, meaning we look at all these things that we've been talking about: access, where you come from, your relationships, and how that relates to your healthcare. And then we work interprofessionally. So we are an interprofessional organization, meaning that anyone in any licensed profession. So we have pharmacists, we have naturopaths, we have chiropractors, we have integrative medicine doctors, we have nurses, we have acupuncturists, all together in one organization, because we know working interprofessionally is the future. And whole health is a model that requires that to function well. And it's worth saying, I think, for our audience who might not be familiar with whole health, that this is an inheritance of holistic health, of integrative health, of these other words that we've had for mind, body, spirit, whole person medicine, that is also seen in Ayurvedic medicine from India or from China, in Chinese medicine. But in this case, it is a program pioneered at the Veterans Administration that includes medical care, but centered on what matters to the patient, and then group care, and also care from other providers, other allied providers, like I just mentioned, including physical therapists and occupational therapists, naturopaths, chiropractors, acupuncturists, massage therapists, psychologists, all working in tandem and all working with deep respect for one another. So when you come to our conference, and I really hope you do, it's at the end of October. We start October 24. First of all, it's been my home, my professional home for decades, because you meet all the people there who hold the values you hold. And sometimes it's lonely out there in the system. And then secondly, we are completely focused on whole health and how do we work together to really create this model for the entire healthcare system that can be better for the patients and better for the providers. And by the way, cost less money.
Thank you. That's beautiful. And hey, it costs less money. That doesn't hurt either. Jeff, same question. Absolutely. Jeff, same question for you. What does it mean to you to make whole health a focus in healthcare?
So I think, as Rachel said, it's really patient-centered care. We say those words, but I mean, you look at how medicine was practiced 100 plus years ago, right? I mean, the providers went to the home and saw all the things that truly affected a person's health. Mm-hmm. You saw the family dynamic, the town dynamic, whatever their faith was, very centered in their life. And then between now and then, or then and now, we move to a provider-centered model, right, where the patients come to us, and we have so much time with the patient, and it becomes almost, sorry, we'll have to schedule another appointment. We're out of time today. And that's really driven from the reimbursement models that, as Rachel mentioned briefly. And so really the opportunity for us here at the Health Science Center, what I'm passionate about is preparing our students and showing our students what's possible. Our educational models and our accreditations, whatever your health profession is really about the science of that specialty or that line of medicine or nursing or whatever it may be, right? And there are these topics of whole health and these other the social determinants of things that affect people's health and well-being, but it's really not something that's tested on. And then if you look at traditional medicine and our graduate medical education programs, our residencies, right? Once again, the funding goes through the hospitals, which goes through a traditional model. And so what we expect is, like Rachel and I have others, that folks to get out into medicine and practice for decades and realize that, this isn't working. And then us having self-discovery and finding something else that works for our patients and then works for ourselves and makes us feel fulfilled in why we got into medicine to begin with. So here at the Health Science Center, that's what we're doing, right? We have a purposely built curriculum to expose our students in the preclinical years. And then having our clinical practice group here with our faculty and bridging that gap between the education, the actual healthcare delivery, the research on showing the differences in outcomes, and then changing the system one step at a time. We didn't get here overnight, so it's not going to just instantly change overnight. But it's taken, eating the elephant one bite at a time and slowly building an awareness. Like Rachel said, the VA has worked on this for decades, and they'll still tell you they haven't perfected it. But it's first of all bringing an awareness of where we want to go, right? We know the end zone is that way. We don't really have the playbook to get there, but we know we all need to be moving down the field toward the end zone.
Mm-hmm. And you speak also of a kind of trajectory of change too. I mean, speaking about healthcare 100 years ago and change to today, what do you think it is about this moment that is bringing to the public consciousness and to the consciousness of providers whole health, either again or for the first time, or why now? What are those factors that have led to the rise of whole health now?
So I think it's probably cyclical. I was discussing with a colleague a little bit ago about a book that she read 130 years ago, where a physician was frustrated with healthcare delivery. And that's kind of where osteopathic medicine came from. An allopathic physician who was frustrated because it wasn't working. So I think people's frustrations with the existing infrastructure, the existing outcomes. I would say today it is the science that we have so much information today. And I think now with electronic health records and looking at the cost of care and comparing our outcomes in the United States to other countries, and you look at the spend versus the longevity. And Rachel has her story. I think we all have our stories. It's one thing to be a provider of healthcare. It's a different to be a consumer of healthcare. And as I see my family, my brother who recently had a traumatic injury and my father who's dealing with chronic illness, it's extremely frustrating because the system that, we think is the best, and it is good. It's not bad, but it could be so much better. I think the consumer's driving it. I think the patients are saying, I've done this forever and I'm not getting the results I want. And so they're really seeking alternatives. And now with the available information and the internets and all things, I really think people are saying, hey, look at this new thing. It's not new. It's been around hundreds of years. And so I think, like as everything, what's new is old and old is new. And I think that's probably what we're seeing.
Thank you. And Rachel, how about for you? What do you attribute that rise in whole health to?
It's a great question. I think that in the Chinese medicine community, they've been doing holistic healthcare for thousands of years. And I think that osteopathy and chiropractic are also holistic models of care. So it's not like this is brand new. But what's new is the Western medical system embracing that as a possibility. I often think of Western medicine as a body that is missing several limbs. I love science. I love surgery, and I love drugs when I need them, and I use them when I need them. But the problem with Western medicine is it's unlike Chinese medicine and Ayurvedic medicine from India that have an exercise tradition, a spiritual tradition, a nutrition tradition, a sexual tradition, a practice tradition, and an herbal tradition and an acupuncture tradition, right? So it's a full circle of human experience. Western medicine has Western medicine, and it looks kind of the same. You take a pill, you cut, maybe you do a little rehab. And what we're missing is literally killing us. We're missing looking at social factors, looking at where you live and where you come from, really looking at psychological factors. We give lip service to it, but we don't have time to actually do it, nor are we supplying someone who can do it for us next door. When I'm a primary care doctor in practice in my town, I'm looking at a list. I'm giving them 5 different psychologists or social workers. Good luck getting an appointment. There's no connection between that care. And what we're talking about is doing all the care in one place. So the social worker who's going to help with access, or maybe even going to make a home visit, or the community healthcare worker, which I think is an essential part of this new model, somebody from the community who actually does go into the homes. I love what Jeff is teaching about. It's so essential, and is able to bring that information back to the healthcare providers so that it's really around whole. That's why it's called whole health. I can see what's possible. I can see what's possible. Our country, the United States, is failing at providing healthcare. I think last time I looked, we're number 20 or 22 for healthcare outcomes in the world. We spend twice as much as the next person, that is Canada, that already spends twice as much as European countries. It's ridiculous. It's embarrassing. If we were a business, we would have been out of business 20 years ago. So I am absolutely ready. And I think it's economically becoming completely untenable to continue with the current system. And so the rise of whole health is all these people who've been doing, all the indigenous people, Chinese medicine, Ayurvedic medicine, chiropractic medicine, everybody's already been doing it. And then the doctors coming on board, in 1977, American Holistic Medical Association, AIHM, bringing everybody together, along with a bunch of other integrative organizations and schools like your own. And now we have board certification in integrative medicine as a medical specialty. That's not a small thing. That brings it to the level of pulmonology or cardiology or any other board certified specialties. So now we have a Western medicine system that, because it's not working and it's economically unfeasible, that it's now open in a new way. And that's probably surprising to people. I keep trying to tell the good news. I feel like I'm preaching out there, but really it is possible. And it's possible because of how bad it is. I know we've been saying this for a while, but it's not getting better. It's actually getting worse. And it's going to be necessary in large institutions like Kaiser or places that already have a patient population. It's a perfect model. So I expect whole health to spread slowly throughout the entire healthcare system because it costs less money. Patients are happier, providers are happier. I mean, I think it's the future.
And both of you come to the table with so much experience as providers in this system and have been so articulate in describing the ways in which the system is broken and challenging, and a number of the changes that need to be implemented. And both of you speak so clearly about them. Rachel, let's start with you. What, from a provider's standpoint, is the biggest barrier to actually making these changes and implementing them?
I'm going to quote my friend Jeff on the panel, who said, "This isn't a failure of the system. We have exactly the system that we've designed with the incentives that we have." He's exactly right. He's exactly spot on, which is that our incentives are to pay. We pay a lot of money for procedures. We pay a lot of money for surgery. We pay a lot of money for highly specialized doctors. We don't pay very much for somebody who's working on preventing the big problem. Going back to my brother-in-law, how much would it have cost to hire a weekly nutritionist to go to his house and help him with food? A whole hell of a lot less than his multiple hospitalizations and his potential transplant surgery and the results of him eating too much sugar and developing severe diabetes and kidney failure. We just have poor incentives. So we have to change our reimbursement system to actually pay to get as an outcome what we want, which is healthy, whole people who are closer to having that thing those things that they value.
Absolutely. Jeff, same question. What do you see as the biggest barrier?
So I think, as Rachel said, it is definitely the reimbursement model which drives our current delivery system. There's opportunities in managed care worlds with shared savings and others. But I think the struggle that we have, especially in the last 20 years I've had trying to deliver these models or develop these models, is that's not how folks are educated, right? And so I'm trying to take providers and send them to a home environment. And what they're seeing is the clinical problem. Versus if I take a firefighter paramedic to the home, they're going to walk in and they're going to see that there's no smoke alarms and, there's rugs or the the elderly person has a small dog that's going to trip them up, right? And so it is really the incentive, the financial model, but I say it's also partially our educational models of many things in the world, history impeding progress. And so it'll happen over time. The VA is the most successful because they have all of those systems of care in one building, right? And so the hard part for the VA is to get the patient into the system, right? Well, for us, as our systems are all over the place, right? We have primary care here, and we have the cardiology specialist there, and the nephrologist is there. And so, as Rachel mentioned earlier, the patients are running all over the place, which is highly inefficient for them. Works great for me because I'm here, and when I'm done with you, I'm going to go to the next room and see the next patient. Mm-hmm. So we have to purposefully, the payers are starting. There's options. It's still not the vast majority of reimbursement, but there are avenues of managed care and opportunities for more whole health. But it's really, we have to purposefully build systems, which means we have to even go back and educate our future providers as we build these systems, because it's much easier to have them work in these new systems than it is take the existing providers and try to get them to see the world as Rachel and I, as many others that are really looking at whole health is. It's hard, really hard.
Absolutely. It is hard, but it's good work, right? This is our last question for both of you, and I love to close on maybe a small celebration of the work that's being done by both organizations. Jeff, could you tell our audience what is HSC doing to prepare the provider of the future for working with whole health?
Right. So first of all, John, we have purposely built an interprofessional team. So we have a Department of Interprofessional Education that falls under my division. And because of that, we are purposely taking faculty from our schools, from the medical school, from our School of Health Professions, which is physicians assistants and pharmacists and physical therapists and nurses and public health, right? So we're working to build curriculum that exposes our students in the preclinical years to this concept of whole health. As Rachel said, this is not new, but unfortunately, most of our students have not been exposed and are not aware of these other things. We call them alternatives, but really it's not an alternative. It's just another avenue, another type of care. And so really exposing them to that in a preclinical setting, mm-hmm. and then moving them into the clinical setting to where they can actually see it and actually practice it. I do believe that then when our folks get out of this and they go into their graduate medical education or wherever they go after, they then see things that they didn't see before. Back to what I said, the eyes will not see what the mind does not know, mm-hmm. right? So we're educating the minds so they can see what's possible. And I think the future is really with that. And that's, our mission here, right? We're not only producing the providers of the future, I want to say that we're preparing the providers of the future.
Absolutely. Wonderful. Thank you. And Rachel, same question for you. What is AIHM doing to prepare the provider of the future for whole health?
Yeah, thank you so much. We are pretty much on fire in my organization about becoming an important, we're going to need to train a lot of people, but becoming one of the key places that people can come as either as already trained providers or before training to be members, where you have access to educational resources. The conference that I already mentioned at the end of October, please join us. It is so much. It may be one of the only conferences you go to where we dance like regularly. It's so fun. And then we offer a fellowship, which is distinguished by being interprofessional. And that's an integrative medicine fellowship. If you're a DO or MD, it does prepare you to be board certified in integrative medicine, but it's for everyone. We have had pharmacists and naturopaths and chiropractors, and we believe training together is the way we need to be doing this thing. If we're going to be interprofessional, if we're going to work together, we should train together. We should be members of the same club, for example. And then we also have online courses that we offer. And we would, encourage you to check us out at aihm.org.
Absolutely. And could you tell us, just as a final question about the conference, why was now the moment to create the Bringing Whole Health to Life conference for you?
Because this organization and its roots back in 1977 that I talked about before, its whole purpose has been to shift the healthcare system toward a holistic, integrative, whole health model. So the opportunity to really do what we were created for, it's exciting. We're all deeply excited about it. And the National Academy of Medicine, which is not a holistic or integrative place, right? This is straight up Western medicine, published their first paper about a year ago on whole health and describing the whole health system, how it works. And then a second paper on how would we implement that in a variety of places, in a private insurance system, in a Kaiser or HMO system, in Medicaid, in Medicare. Specifically, how would we do that? So we feel like this is the time. The time is ripe. We've got a lot of smart people working on this, and I think it is the next revolution in healthcare.
Thank you so much. Okay, listeners, you heard Rachel tell us why it matters to join her and other leaders at the Bringing Whole Health to Life conference. In fact, she and AIHM are inviting you to register now, and you'll receive 15% off at the conference registration fee. You can scan the QR code at the end of this podcast, and it'll take you right to the registration page. Enter the promo code WholeHealth24, all caps and no spaces, and complete the information. For those who are not listening and not watching today's podcast, go to AIHMconference.org and enter the promo code we just mentioned. We hope to see you there. That's a wrap for our episode today. I hope you found this conversation to be as rich, energizing, and as inspiring as I have. Again, Jeff and Rachel, thank you both for giving us your time and for all that you are doing to make this world a better, whole, and healthier place. Thank you.
Thanks so much.